Assalamu Alaikum viewers, welcome back to my YouTube channel. So today I'm telling you about basic dental terminologies. So in future it helps you to better understand and communicate with your dentist. So let's start it. Okay, so types of teeth. So there are 4 types of teeth which are present in our oral cavity, including incisors, canine, premolars and molars. So total we have 32 numbers of teeth, including wisdom tooth, which are erupting during 18 years, after 18 years. So we have so we have 8 incisors, 4 canines, 8 premolars and 8 molars, excluding wisdom tooth, which are 4, which erupt after 18 years of age, after puberty. So I'm illustrating you. Okay, so this is our oral cavity. As you can see, this is an upper arch, and this is our lower arch. Okay, so the lower arch is known as mandibular arch. Okay, ignore my writing. And the upper arch is known as maxillary arch. As you know, this is tongue, these are lips. Okay, so total 16 teeth are present in upper arch and 16 teeth are present in lower arch. Total is 32. Okay, so this is the presentation of a primary tooth, and the presentation of permanent teeth. Okay, so in primary teeth we have only incisors, canines and molars. Premolars are absent in primary dentition. They are erupting after after 6 years, because these are included in permanent dentition. So in primary dentition, premolars are absent. These molars are replaced by permanent premolars. Okay, so as you see, incisors are presented by green color, canines are represented by orange color, and the molars are presented by blue color. And then in permanent dentition, they see premolars are presented by yellow color. Okay, next, surfaces of teeth. So basically there are 4 surfaces of each tooth. This is the incisal view and this is the occlusal view. So incisal view is for interior teeth, occlusal view is for posterior teeth. Okay, so in case of incisor tooth, we have 4 surfaces. This is labial, mesial, lingual and distal. So the labial and lingual surfaces are easy to understand. So the surface which facing towards lips are known as labial surface or facial surface, and the surface which facing towards the lingual surface, and the surface which facing towards tongue is known as lingual surface, and facing towards the palate is known as palatal surface in case of maxillary teeth. Okay, so now you have to know what is mesial and distal surface. So this is a midline which draw from the middle of the teeth between incisors, between 2 central incisors. Okay, between 2 central incisors a midline is drawn. Okay, the surface of teeth, this is a lateral incisor. So as you can see, the surface of teeth which facing the midline is known as mesial surface, and the surface of teeth which facing the posterior surface is known as distal surface. Same is case with posterior teeth. As you see, it's a molar. So the surface facing towards the midline is known as mesial surface, facing towards posterior is known as distal surface, buccal side is known as buccal surface, and the lingual side is known as lingual surface. Hope you can understand. Okay, so the next is numbering system. So basically there are three numbering system: universal numbering system, Palmer notation, and the FDI system. I do not go in detail. I'm simply telling you about the basic universal numbering system. So in deciduous teeth, the numbering system is represented by alphabets, but in case of permanent teeth, numbering system is represented by numbers. Okay, so in deciduous teeth, it starts from the maxillary upper right side. Okay, maxillary right side says start from the maxillary right side. So it begins with A, B, C, D, E, F, G. It goes clockwise. As you can say, it starts from the A and in J. So in mandibular start with K and end with T. In case of permanent teeth, it starts with numbers. So same, start with maxillary right side, it's the left side. So it goes like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 clockwise and add to 32 number. So parts of tooth. So enamel, parts of tooth basically are enamel, dentine, pulp, gingiva, root canal, वगैरह. So in the outermost layer which we see clinically is known as enamel. It's the most hardest and outermost part of the tooth, and it's 96% mineralized. It's a hard structure. Then below to enamel is dentine, which is less mineralized to enamel, and it is sensitive. The patient feels sensitivity and pain because of dentine, because this structure is sensitive. So when enamel damage, cold and heat enter through this path and cause sensitivity and pain in dentine. Okay, so this is pulp cavity, which is living tissue, blood and nerve vessels run through pulp of teeth. Okay, so the coronal part cover up. Now in root section, there is a structure known as cementum, which run along dentine side in the root area. This is known as cementum. When gingiva recede, cementum expose, which also cause sensitivity. Okay, then this is cementum. Then we have PDL. Okay, this is PDL. So this PDL, periodontal ligament, present between the cementum and the alveolar bone. It attaches the tooth to the alveolar bone. It is it's act like a cushioning effect. It's provide a cushioning effect because it has fluid which provide cushioning effect. Okay, so this is the crown area, the neck area, and the root area. Okay, so now we have I'm telling you about the clinical crown and root. So it's a basic term. So the part of tooth which we see clinically in our mouth is known as clinical crown. Okay, and the part of tooth which we can't see clinically is known as clinical root. In term is known as the clinical crown is the portion above gingival margins, and the portion below gingival margins is known as clinical root. So the anatomical crown is the portion above cemento-enamel junction. So you want to know what is cemento-enamel junction. So cemento-enamel junction is the cemento-enamel junction is the area Cemento-enamel junction is the area where cementum and enamel meets. This junction is known as cemento-enamel junction. Okay, so in case of anatomical crown, the portion above cemento-enamel junction is known as anatomical crown, and the portion below cemento-enamel junction is known as anatomical root. So the anatomical crown and root is fixed, but clinical crown and clinical root is not fixed, because in case of gingival recession, as you can see, this is gingival recession. Okay, so as you can see, in case of gingival recession, root is also exposed. So in this case, clinical crown is more. As you can see, clinical crown is more, because as you know, portion above the gingival margin is known as clinical crown. So if in case gingiva recede, the clinical crown portion is also increased, but the anatomical portion remains constant, and clinical root portion is decreased. Thank you for watching. If you like this video, please like, share and hit the bell icon button and subscribe my channel.